Good afternoon. I would like to start the service with a land acknowledgement. We are all treaties people. I would like to acknowledge that all UHN facilities are situated upon the traditional territories of the Wendat, Anishinaabeg Nation, the Haudenosaunee Confederacy, the Mississaugas of the New Credit First Nations, and the Métis Nation.
Hello. Today is a day of remembrance, a very bittersweet day for those of us at UHN. Bitter in thinking of the over 22,000 lives lost across Canada to this horrible disease, and over 2.5 million lives around the world. But a sweet day in knowing what you've done to contribute to supporting so many families, so many patients, and each other. In thanking you, I also want to thank your families, because I know, especially in the early days of this pandemic, each day you went home was a frightening one. You were frightened about bringing this disease home to those you loved. You were worried about infecting others. You were worried about how to get to work safely. When you were at work, how to protect your patients and how to protect those you work with. So in each and every way, I don't think we could be more proud of Team UHN and thank you enough for what you've done in this past very challenging year. A year like no other for those of us who worked in healthcare for a long time.
We acknowledge the emotions of sadness, fear, and anger that we continue to experience in the midst of this pandemic. Let us not forget the moment of hope and solidarity that fills our lives, like returning home to clean paths in the midst of our exhaustion. A reminder that our efforts are recognized by those we serve.
Grieving is an important process. There's no one right way to grieve. What it feels like and how much time it takes is different for every person. It's important that we're patient with each other when we're grieving. And sometimes it's useful to reach out to another person who can listen objectively and help us understand our feelings.
Asking for help is a strength, not a weakness, as some have said. Are we able to trust that this could possibly be true? Is it possible that we could be as kind and gentle with ourselves as we would be with a close friend? Healing is a slow process. Giving ourselves the time we need to grieve is necessary as we move towards a renewed sense of meaning and purpose in our lives.
Today, we acknowledge all those impacted by COVID-19 here at UHN, across Canada, and the world.
May we remember the pain, suffering, emotional, and physical exhaustion that we've all endured.
Today is a day of reflection as we reflect on the pain families faced as they were physically separated from their loved ones.
May we bring light to bear on the darkness which this pandemic brings to all who are touched by its reality.
Today is a day of past battles where we acknowledge the personal sacrifices of Team UHN, putting the needs of patients and families before their own.
May we continue to reflect on the meaning of life and the purpose for which we were born.
I invite you to join in a moment of silence as we collectively grieve the losses we've experienced over the last year.
We light the first candle to remember all those who have died as a result of COVID-19 and those who've suffered the effects of this pandemic. We pause to remember them, their names, their voices, and what made them special, the memories that bind them to us.
May eternal love surround them.
The second candle we light to honor our grief and the depth of our loss. As we experience the hurt of the present and the past, we ask that our broken hearts will be placed the gift of comfort and peace.
We ask for healing and peace in this time of our need. The third candle we light to remember those who stand with us in our pain, who take the time to listen, and who create a safe space for us to grieve.
We're grateful for the love that comes to us in the care and support of others.
The fourth candle we light as a sign of anticipation that each day may find us moving toward the end of pandemic, and that each day as well may leave us with hope.
We trust in the coming of rest and hope.
As the flame of a candle scatters the darkness, and as the dawn signals an end to night, may the light of hope break through the darkness of our sadness. Although the flame of these candles will be extinguished, may enduring love enable us to continue our lives in love and in hope.
In the rising of the sun and in its going down, we remember you. In the blowing of the wind and in the chill of winter, we remember you.
In the opening of buds and in the rebirth of spring, we remember you. In the blueness of the sky and the warmth of summer, we remember you.
In the rustling of the leaves and in the beauty of autumn, we remember you. In the beginning of the year and when it ends, we remember you.
When we are weary and in need of strength, we remember you. When we are lost and sick of heart, we remember you.
When we have joys we yearn to share, we remember you.
Thank you for joining us for our Day of Remembrance. Even as we continue to serve patients and communities in the fight against COVID-19, it's important we take time to pause and grieve the losses of the past year. We hope by coming together to commemorate, reflect, and remember, it allows each of us to understand we are not alone in our grief. We also know many of us will continue to come to terms with this loss in our own way and on our own time. Please know that there are staff wellness and mental health resources available. In closing today, we present the poem, The Well of Grief by David White.
Those who will not slip beneath the still surface on the well of grief, turning down through its black water to the place we cannot breathe. We'll never know the source from which we drink, the secret water, cold and clear, nor find in the darkness glimmering the small round coins thrown by those who wished for something else.